Hello.
Hi, I'm Jenna. I'll be your nurse today. I just wanted to stop in because I do have some doctor's orders to draw some lab specimens from you. Um, is that okay with you today?
That is
Can you tell me your name and birth date, please?
Joe Smith, 10553.
All right, Joe, and do you have any allergies?
Just the sulfa.
Okay, I'm just going to make sure I wash my hands here. And I do want to make sure I pull that curtain for privacy. All right. So again, like I said, we will be drawing a blood specimen from you today, Joe. I just want to go through and what supplies I need to make sure I'm prepared. I will need my tourniquet, my 2x2 gauze. I need an alcohol prep pad. I need a pair of gloves. I will need a vacutainer holder along with a venipuncture needle and also my collection tubes. My collection tubes are, I need to select based on what labs my doctor has ordered, and I also need to be aware that there's a specific order that I need to draw these tubes because some tubes have preservatives and others do not, and if you don't draw them in order, it can disrupt or cause errors in lab values. So I need to draw my red first and then my purple top.
So first we're going to assess the site and palpate the veins to see if we can find a good one. The most common site is the antecubital site. We may put the tourniquet on 3 to 4 inches above the site to help with that vein popping up or plumping more easily to fill. Sometimes we have patients close their fists, which helps make those plump up as well. So once we find a site, we're going to go ahead and put our gloves on. And put the tourniquet back on so that way we can find that location again before cleaning it. And go ahead and clean that site. We're putting the alcohol pad down, pointing in the direction of where we're going to insert. Now we have our needle and our supplies that we're going to put together. We always make sure that rubber side is actually in that tube holder. So it's the clear side, goes in with clear to clear. Next, Jenna's going to position the needle holder and the syringe with needle bevel up and the shaft parallel to the path of the vein at a 30-degree angle to the arm. She may use her left thumb to pull back on that skin to help pull it taut.
All right, Joe, I'm going to insert the needle. You'll feel a poke.
All right. So once she gets it in there, she'll kind of feel this pop feeling, and then she's going to press her fingers into the arm to anchor the holder. So that left hand is anchoring and her right hand goes ahead and puts the vacutainer in and fills it up completely full of blood until it stops, and then she inverts it slowly to help mix it, help it from clotting. She puts the second one in and releases that tourniquet, and that one fills until it's full, and again inverting it. Then when she's done, she's going to go ahead and put a 2x2 on there and pull straight back, and then she's going to put on the safety lock on the table and hold pressure for 2 to 3 minutes or until the bleeding stops.
Disposing of sharps in your sharp container.
And then she may choose to put a piece of tape over that.
In this situation, you can also have your patient hold pressure on the site while you prepare the tape to be applied. If you have a patient that's on blood thinners, please be aware that you may have to hold pressure for up to 5 minutes, and also have the patient maybe raise their hand above their head. You may even have to apply a little bit of Coban to keep continuous pressure on that area. All right, once you've ensured bleeding has stopped, you will want to make sure that you label your vacutainer tube, collection tubes. In a hospital setting, these will be printed, a patient label will be printed with the, all the patient information, MR number, date, and the ordering doctor. If you're drawing these in a nursing home setting, you would have a patient label as well, and you'd have to initial it and the collection date and time. Once collected, send them off to lab.
And thank them for allowing you to draw blood, and ask them, is there anything else I can do for you today while I have time?